Hey, how are you today? I hope you're well. One of the things I want to talk to you about is a significant number of clients that I see have had some experience of talking therapies before, but somehow I felt processed, not necessarily heard by the way things were done. Now, I'm not trying to obviously blame any individual therapist or suggest that behavioral therapies, which are slightly more measure orientated, are in some way faulty. I think cognitive behavior therapy and others of the same kind are very useful in very specific scenarios, and they produce great results. So this is not a video about criticizing anything. All I will try to suggest is that a person is a lot more complex than a score, than a measurement in this way, and the mental health is a lot more varied in this way. Now, those who practice these measures will argue that, of course, this is the case, but what they need to do is to apply a certain technique in a very specific way, measure the results, and then obviously judge the efficacy of that tool. And therefore, they know that the person is more complicated, but they are very surgical in their approach and the way they actually attend to a person's needs. Now, that's all good. I have no problem with this whatsoever. What I do have a slight problem with is the way we diagnose people, with the way we kind of measure people using scales of any kind, whether they're personality scales, depressive scales, whatever. And essentially, we judge the intervention we need to perform on someone based on a score, which is a very, I would say, impersonal way of dealing with any human being. Ultimately, I think the strength of talking therapies is the connection between two human beings, which no manner of scoring will possibly replace. And there is a tendency with a lot of especially governmental or NHS agencies to have this kind of cookbook therapeutic approach where a therapist is given essentially a range of outcomes and a range of techniques, and it's told, person comes to you with this, you apply this, you measure it, they go away, and they're better. Now, if I go to someone who practices CBT and they measure me to be, I don't know, a 9 in a scale of anxiety, for example, and then I go away after the course of 6-7 sessions and they measure me to be a 7 on the scale of anxiety, now that's clearly an improvement. But what does that really mean? How is that really impacting my life? And I think this is part of the point I want to make to you today. When you talk to a therapist, think about what's more important to you. Are you the type of person that just responds to instruction? And that's cool if you are. And then obviously pick somebody who does that. Or are you the type of person that basically seeks some sort of connection? You have an unmet need in terms of connecting with another human being that you want to address. And the therapist you talk to needs to provide that. Because a lot of people I talk to have been for therapy and haven't had that need met. They haven't really felt that they've been heard. They haven't felt that they've been cared for. They felt that they've been processed. And I think that's a worrying trend in our services. But we also have to remember there's a book which I'll put in the details, in video details, called The Pursuit of Happiness, or The Industry of Happiness, by William Davies. And one of the points that he makes, which I think is very valid, is that mental health is now big business. Mental health is now about keeping an increasingly stressed and worried workforce operational. I'm not going to get into the whole socialism, capitalism, whatever debate, because I don't think that's the point here. But you have to think about, why do we have employee-assisted programs, which are very, very regimented in the way they measure things? Why do we have IAPT, which is increased access to psychotherapeutic therapies, which is essentially another measured tool? Because we need, as an industry, to produce results which are quantifiable, to show governments why we are deserving of the funding, such as it is. But more importantly, we need to keep the workforce happy. We need to make sure they turn up to work and they do what they're told, or whatever they're supposed to. Now, that's all great from a model where essentially producing any form of capital is great. But what does that mean for the actual human? How are their needs met? How is this individual person feeling about themselves and their place in the world, apart from being a tiny cog in a big machine? So I'm not an anti-capitalist, I'm not a pro-socialist, I'm not an anti or pro-anything for that matter. But my point is that you have to choose a mental health therapist which is suitable for you and which meets your needs, whatever they may be. But don't settle to just being processed. Always attempt to be heard. I hope you have a very good day. and I'll talk to you later. Bye now.